We've got a wild problem in Missouri right now because a new Justice Department report revealed that Missouri's breaking federal law by unnecessarily putting thousands of adults with mental disabilities into nursing homes instead of actually providing them with the proper care they need. And according to the report, we're talking about 3,300 adults with mental health disabilities who spent at least 100 days in one of the state's nursing homes as of March 2023. Though that number also doesn't include people with Alzheimer's and dementia who may actually be able to benefit from specified care provided by those facilities. And with that, you had the DOJ finding that the average age was 53, which is unheard of. That's more than 20 years younger than the statewide average for all nursing home residents, which is 75. And I mean, hell, some of the adults placed in literal nursing homes were in their 20s and 30s. And beyond just their age, a majority of adults with mental disabilities who were placed in these facilities, they did not have the physical needs that would require the help usually provided by nursing home staff. Like eating, using the bathroom, or being transferred in and out of bed. And the DOJ explaining the fact that adults with mental health disabilities in nursing facilities in Missouri tend to have relatively low need for nursing care highlights why nursing facilities are not appropriate for these individuals. Saying beyond that, Missouri also places a higher percentage of adults with bipolar disorder or schizophrenia in nursing facilities than almost any other state. And in some of the nursing homes, these patients make up 80% or even 90% of the entire resident population. And that matters for a number of reasons, starting with nursing homes usually don't have specialized care for those folks beyond just giving them medication. The DOJ also finding this is true for people with other mental disabilities who are being placed in these homes. When you take a step back and you look at these groups who have been put under the care of nursing homes, the federal report says almost none of the adults with mental health disabilities living in nursing facilities in Missouri need to be in these institutions, even for short-term stays. And it's not like these people feel like they're getting any sort of special benefits from these facilities that they can't get elsewhere, with the agency specifically stating almost uniformly adults with mental health disabilities in Missouri's nursing facilities do not want to live in these institutions. Right? Nursing homes are incredibly restrictive, and the vast majority of adults with mental disabilities want to be integrated into the community and given more freedom, like through services like permanent supportive housing or comprehensive treatment programs that can provide them with a safety net of resources to live more independently. And that's something we saw these people and their family telling DOJ investigators. Like Angela, for example, a woman in her late 50s who was placed in a nursing home against her will, saying, "I have a dream that one day I will be free. Free to live on my own, free to live within my community, free to have overnight visits with my grandchildren, free to not be told who I can associate with, free to not have someone place me in a nursing home and leave me without any regard to my well-being mentally and physically, most of all, just free to live my life." But also, regardless of how you or I might feel about all this, it's literally just illegal under federal law, plain and simple, full stop. Because under the Americans with Disabilities Act, it's illegal for states to unnecessarily separate people with disabilities from the general population when they're able and willing to be served adequately by community-based services. And that separation, it amounts to discrimination against people with disabilities, and states are actually required to provide, quote, services, programs, and activities in the most integrated setting appropriate to the needs of qualified individuals with disabilities. And that last phrase is a key thing here, right? Because the DOJ explicitly found that the vast majority of nursing facility residents with mental health disabilities are qualified and appropriate for community-based services. When a state doesn't have sufficient services to properly accommodate these populations, it is required to make reasonable changes to its policies and procedures. But that is exactly what Missouri has failed to do. Right? Missouri does have programs that help adults with mental disabilities integrate into their communities. The state just doesn't want to expand them far enough, with the DOJ finding that thousands of adults with mental health disabilities are unnecessarily shut away in nursing homes because of deliberate policy choices made by the state. Because instead of setting up enough programs, services, and facilities that actually can cater to the needs of these people, Missouri just sticks them in nursing homes. And not only does the state lack proper resources for adults with disabilities, the whole system the state has created here literally incentivizes placing these groups in nursing homes that do not serve them. And they actually do this in a few different ways, right? First of all, the state recently implemented a points-based system that quite literally is intended to increase nursing facility eligibility for adults with mental health disabilities. And Missouri has even put in place actual financial incentives to ensure more people with mental health disabilities go to nursing homes. The state also recently updating its placement system so that nursing homes are actually paid an extra $5 per resident each day if 40% or more of the facility's residents who receive Medicaid have schizophrenia or bipolar disorder. A move that the DOJ estimates has resulted in nursing homes getting paid $222.8 million from Missouri Medicaid just in the last fiscal year alone. And beyond that, the state also lacks effective processes to screen out people who don't need to be in nursing homes or divert them to other care, or even proper systems to transition them from nursing homes to services that would better accommodate them. But one of the biggest issues with the overall system here is Missouri's procedures around guardianship, where someone is appointed to make every decision for a person with mental disabilities. Because while guardianship is only supposed to be used in the most extreme of situations, Missouri has heavily relied on this tool as a catch-all for people who are resisting treatments or who have been cycling in and out of psychiatric hospitals. In fact, 62% of the adults with mental health disabilities living in nursing facilities interviewed in the DOJ inquiry, they were under guardianships. And 80% of those people had a public administrator as their guardian, not a family member or a friend. And that's significant because many public administrators who serve as guardians have been placing these folks in nursing nursing homes, with one provider even calling guardianship in Missouri a sentence to be locked in a nursing facility. And all of this despite the DOJ finding that adults with mental health disabilities living in Missouri's nursing facilities generally do not need guardianships. And so by forcing people who don't need guardians into a guardianship, Missouri is actually violating its own state law. And just in general, there's a lot of really damning shit here, though as far as what happens next, technically Missouri will be required to work with the DOJ to fix the violations that the agency found. And then if they can't or they won't, the department can sue the state for compliance. But in the meantime, you have thousands of affected people that are just gonna still be in this situation.